Ah, my delightfully arrhythmic darlings 35, every heartbeat of yours is chaos. Every pause is poetry. Tonight, we serenade ARVC, Arrhythmogenic Right Ventricular Cardiomyopathy. 1. The cardiomyopathy that DJs your ventricle with fat and fibrous beats and drops the bass straight into sudden death. Compared to this, even aortic stenosis sucks 6 rusty gate sounds harmonious. Pathophysiology, month 1, when your RV gets catfished. Inherited autosomal dominant 1, but expression is mood swingy. Demosome gene mutations cause cells to lose their ability to hold hands, leading the wall to fall apart. The right ventricle is replaced with fatty and fibro-fatty tissue, causing electrical chaos. Around 50% of cases are confirmed mutations. Villain roast. Imagine replacing your cardiac muscle with butter and scar tissue. Deliciously inefficient. Mnemonic. Fat fibers delete rhythm stands for fatty infiltration, fibro-fatty replacement, demosome defect, and RV dysfunction. Clinical features: the young, the breathless, the doomed, classic victim, age 20 to 40, collapsing mid-sports, palpitations, VT is the opening act, syncope, during, after exercise, dyspnea, RV too tired to pump, chest pain, post-workout whimper, right HF signs, edema, ascites, JVP up, sudden cardiac death, first and final curtain call. Mnemonic, please stop dropping collapsing right now. Palpitations, syncope, dyspnea, chest pain, right heart failure, sudden death. Investigations, electrogoth detectives. ECG shows T-wave inversion in V13 and Epsilon wave, which is a tiny ghost notch in the QRS complex. Echo reveals subtle early signs with the right ventricle enlarged and hyperkinetic later. MRI demonstrates fibro-fatty tissue, which can be imagined as the right ventricle cosplaying as cheese. The mnemonic to remember is EEE. ECG features including T inversion and Epsilon wave, echo showing right ventricular changes, and EMRI indicating fat and fibrosis. Management, keeping the beat, barely. Pharma, beta blockers, calm the chaos. Sotalol, amiodarone, if stubborn. ACE, ARB, if LVHF joins the drama. Non-pharma, ICD, the guardian angel zapper. Catheter ablation, burn baby burn. No sports, your ventricle can't handle CrossFit. Genetics, screen the fam. It's not just you cursed, darling. Pickup line. Are you an ICD because you shocked me back to life? Complications. Encore of tragedy. Ventricular arrhythmias lead to ventricular tachycardia, ventricular fibrillation, and collapse. Sudden cardiac death can occur, especially in young athletes, often mid-sprint. Right-sided issues progress to biventricular heart failure, eventually resulting in dilated cardiomyopathy. Atrial arrhythmias, such as atrial, as fibrillation or flutter increased stroke risk. Thromboembolism may cause stroke or peripheral emboli. The mnemonic to remember this is very sudden right atrial thrombi, ventricular arrhythmias, sudden cardiac death, right heart failure, atrial arrhythmias, thromboembolism. My gloriously unstable interns, ARVC is proof that rhythm is overrated. Palpitations, syncope, sudden collapse, the ventricle's way of saying plot twist. Remember, screen the family, block the beta, and never trust an epsilon wave. Now leave me your comments, dears, for I shall roast 3 comments in the comments section.